News stories were coming in about this strange virus in Wuhan, China. It was weeks before we saw the first cases in the US. As the numbers went up each day, my curiosity got the best of me, and I started plotting the curves. Here's stories from real people all over the world and how they've responded. I'm Sally Hendrick, founder of Shout Your Cause, and this is COVID-19, The World Responds. Hi, Alison. My name is Sally Hendrick. How are you doing?
I'm doing great, Sally. How are you?
Good, good. Thank you so much for meeting with me today. I am excited to talk to you about what's going on because you're in Tennessee, I'm in Tennessee, and I'm speaking with people from all over the world about what's happening with the COVID-19 coronavirus pandemic response. The thing is here, and we've got something we have to deal with and potentially manage, and it's spreading all around. And I wanted to, ask you a little bit about, what are you doing? Like, what kind of doctor are you? And, what do you do?
Yeah, no, that's a great question, Sally, and I'm glad you're doing this. So I'm a cardiologist, which means I take care of people who have heart disease. And we know that patients with heart disease seem to be having a higher risk of having a bad outcome if they get this virus. So I actually specialize in heart failure, but I see all sorts of different patients. Now, I live in Chattanooga, Tennessee, but I'm actually working in Kentucky right now. And so it's been pretty eye-opening to me to see the difference between the two communities as well, just sort of as the response of the leaders in both states has been different.
Yes, and I noticed that the other day there was a press conference from the Kentucky governor talking about what was going on in Kentucky versus what was happening in Tennessee. So it's very interesting perspective that you have both of that. So thank you. I'm glad that I know that. Are you working at all in Chattanooga right now?
I am not working in Chattanooga right now. I am working in Kentucky doing cardiology, both inpatient and outpatient. And I can kind of explain to you what we've done there if you have any interest in how it's affected our daily practice.
Yeah, definitely would like to know what's going on with that.
Yeah, no, so I work at an hospital, and starting last week, we moved to telemedicine for the majority of the patients. So in the past, you could do telemedicine, but there was some pretty strict legislation about that. And so CMS and Medicare last week loosened that up. And so it was you can actually do it over Zoom, over Facebook Messenger, over DoxyMe, over FaceTime. And in the past, you couldn't use any of those methods to do a virtual visit. It had to be a HIPAA-compliant software. But we know it's the right thing for our patients, especially for these routine follow-ups. If you have heart disease or heart failure, you need your routine follow-up. I mean, that's what helps keep you out of the hospital. But when you get to the office and get around people, you can't be socially distant. So we started doing that last week. And by this past week, I would say we were at 95% telemedicine visits. We still kept the office open, so if someone was really ill, we felt they would be at lower risk coming into our office than going to the ER, where all of the patients with COVID are going. But the overwhelming majority of our visits have been just like this, via video, or for our patients that don't have video, we've been doing phone visits because we feel like that's safer for our patients otherwise.
Now, if they have symptoms of the COVID-19, are you then telling them on the phone what they need to do to make sure they isolate themselves?
Yes, I found that a lot of our visits, we've talked about COVID as much as their chronic coronary artery disease or their heart failure. And we have, from my perspective, based on everything I've read and what the CDC's recommended, if you have fever, chills, myalgias, the same sorts of things, muscle aches and pains that you would get with the flu, you should basically probably assume that's COVID. And the people who really get into trouble, about 80% of people will have a mild illness that don't need to be in a hospital.
Right.
About, 15% will be more ill, and about 5% will require critical care services, things like ICUs and ventilators. And all of that seems to be associated with chest pain complaints and shortness of breath. So I've been telling people, as long as you don't have shortness of breath or chest pain, I think you're okay at home. if you have some way to monitor your oxygen level, and a lot of our patients do because there's so much virtual technology now.
Right.
As long as your oxygen levels are staying, within a normal range, I would say, above 92%, it's probably okay to be at home.
Now, do you know how long, if they are potentially holding this virus, how long is it before it passes that they can actually step out of this self-quarantine situation?
Well, I think it's still, we don't really know is what I would tell you is the true answer. If you look for healthcare workers, most places are saying 7 days from the onset of symptoms, after the symptoms have gotten better before you would come back around. And then you would need to wear a face mask. It probably depends on where you go. I would say as long as you can stay away from other people, the better. There's been some data that people can shed the virus asymptomatically or without symptoms for up to 30 days after an infection.
Wow.
Yeah. And, I think we think the median is probably a week or so, but, we don't really know. We're learning more about this every single day.
Okay. So in other words, the people that are not showing those symptoms, and I've heard super shedders.
Yes.
Is that what it is? And the super shedders are passing this around potentially for, longer periods of time, or for at least not knowing that they're passing it around. Maybe they don't even have any symptoms ever. Is that possible as well?
That's possible. It's sort of springtime in the South here. So, most of us have a little bit of allergies or a sniffly nose, when everything blooming out, especially as warm as it is right now.
Right.
And so it's hard to know. Some people have a very mild illness. When you go back and look at antibodies, they didn't really even know they were sick. And so it's part of what makes the social distancing so important, because most people will be spreading the virus before they ever have a symptom. And so, you may think you feel fine, but you're out there, at a party like some of these. As I was driving through college campus, I saw a lot of, groups of 10 or 15 people out relaxing, college kids.
Yeah.
Which is probably not a good idea.
Okay, I understand. And of course, we've heard a lot in the news about the spring breakers that were in Florida over the last couple of weeks and so forth. Now, as far as you're working in Kentucky, but you're from Chattanooga. So are you living in Chattanooga right now and going to Kentucky for your practice?
I am. I'd been in Kentucky for 3 weeks, and last week came back for a weekend, and sort of the same thing now, and I'll be gone for a couple of weeks. Right now there aren't travel restrictions. I'm anticipating that if things get worse, that may happen, and I may end up having to stay in Kentucky. The governor of Kentucky had actually made a statement yesterday advising Kentuckians not to visit Tennessee.
Yeah. I know. I saw that.
Yeah, because I think it was yesterday. It was one day this week, because there weren't the same sort of movement containment, I think, that they've seen in Kentucky.
Right. And so what are you seeing personally, like from a personal standpoint, when you are at home versus when you're in Kentucky? Do you see a big difference there?
Yes. So I drove, so for 2 weeks, I've driven from Kentucky, Frankfort, Kentucky to Chattanooga, and it's all been interstate, and it's been pretty dead. The city there's not very many people there. Restaurants were closed last week, or dining rooms the week before last. And so
in Frankfort, in Kentucky?
Yeah, in Kentucky. And salons and gyms and all that were closed last week as well. And so when you're driving around during the day, there's just not very many cars. Almost a lot of people, everyone but non-essential workers have been moved to telework if possible. And so there's just not very much traffic. I go out and take a walk every evening, and there's very few people out moving around. And then when I came back to Chattanooga, as I was driving back to Chattanooga, between, I would say, Knoxville and Chattanooga, it seems like a normal amount of traffic to me. It's no different than what it normally was. And when I'm on the interstate coming from Kentucky, there's really not that much traffic. It's a very palpable difference.
Well, what about on the streets in Chattanooga as far as people moving around?
Yeah, so, I honestly, I was over on the Shallerford Road side of town last week, which is one of the busier sides, and I couldn't tell much of a difference. It was pretty busy. It was the middle of the afternoon. It was about 2:30, and there was a lot of traffic and a lot of people going around, moving around. Now in our neighborhood, Yeah, in our neighborhood, I can't tell much. I mean, there's people out walking around, but everybody seems to be, trying to stay away from each other. I haven't seen large groups of people. So, I think it's probably in neighborhoods, it seems like people's doing a better job.
Yeah. So in all of this, I know that, we're not in a situation here in Tennessee or in Kentucky yet where it's, like it is in New York or Italy or whatever, which are really scary stories coming out of there. So what is your biggest fear about this, of what could be happening in the next 2 or 3 weeks?
Yeah, so I have a lot of friends in New York. Chicago is also hard hit right now, as well as Seattle and California. And then, of course, Louisiana is,
Yeah, Louisiana.
New Orleans, and then Atlanta is getting hit pretty hard right now as well. And so, what it seems is all of those places are such tight living structures that it's been much harder to be socially distanced, and that's when the virus spreads so rapidly, when people are in close proximity. So what I hope doesn't happen is that we see in more rural areas or areas that aren't quite as urban as those places, that we take for granted that it isn't going to happen here, and that we have over prepared, and then people become very lax, and then we start seeing rapid spread. If you look at modeling, I'm not an epidemiologist, but if you look at epidemiologic modeling, the peak is not supposed to happen until probably early May. And that's still, weeks of time for us to continue this social distancing. And so what I hope is that we have over-prepared and it never comes. That tsunami of patients coming in that overwhelms the healthcare system never comes, and we can say, oh my gosh, we over-prepared. That would be the best case scenario. But what I fear is people are going to become lax of being in the house and staying away. And, they aren't going to see as many sick people as we thought early on. Like, not every place is going to be New York. Not every place is going to be New Orleans. And then people become lax again, and we don't do what we should. Right. Because the problem is, we're already short on these personal protective equipment, and that's going to take a while to replete that population. And, you go through a lot of those with each of these patients in just a normal setting in a hospital.
How many would you go through in a day? Like, let's say how many patients do you normally have anyway in a day?
It probably depends on where you're at, if you're in an ICU or if you're on the floor. But if you're in a typical 10-bed ICU, which is, a smaller side of an ICU, and each patient has, a concern for COVID. So the problem is multifold right now. We can send the test, but in most places, the test is taking 5 to 7 days to come back. So even the people that you suspect, you have to pretend that they're positive and use all of that aggressive personal protective equipment. And so for patients who are positive, requires the most equipment, and you really, want to be careful because it lives on surfaces for up to 72 hours. And so you want to be careful, and everybody wears a gown, gloves, an N95 respirator, which is the special one that filters out the microns, especially if you're doing anything that is has aerosolized or, sputum or anything coming out. Right. And then goggles or a face shield, and probably a hairnet if you want to be the safe, something over your hair if you want to be the safest. But if you think about every single time you go into a patient room, you have to do that. And then coming out, you have to take all of that off and try not to touch yourself with everything, and then dispose of it.
For each patient?
For each patient,
you have to change every time you go from room to room. And nurses, oh my gosh, because nurses are going through it how many times a day? That's
multiple. Yeah. And then if you have a patient that's having breathing difficulties, you have more members of the care team. So what every hospital is trying to do is to simplify care as much as possible. So if I know I need labs checked, try to get the labs checked just once a day, or put everything together so that when the nurse goes in there to do vital signs and, give medicines, they can do the lab draws and everything with just one set of equipment. But, it's really thinking about things like that. And it is a big ordeal, especially when someone's COVID positive, to make sure you don't touch yourself with any of the materials you're taking off.
Right. Well, and then what I would think about too would be, you're coming in as the doctor, and the nurses are coming in, the respiratory therapists are coming in, and all of the people. And imagine being the patient And seeing all of that, that's got to be an incredibly difficult emotional experience for the patient.
Absolutely, you know, and hospitals aren't allowing visitors right now, so the patients are by themselves. You know, we're trying to do, you know, CMS has also allowed for virtual consults, so I can do a consult over a phone to save personal protective equipment.
Right.
Unless there's some reason I need to physically go in the room and touch the patient, which with cardiology sometimes there is. Sometimes we do need to listen, but you know, we're really trying to minimize the number of people who go in the room because it's a potential exposure every time.
So knowing all of these things that you guys are having to change as far as the care and you know, multitasking and putting more things within one visit to the room, do you think that that's going to potentially change the way that healthcare is looked at later on, that maybe some efficiencies would come out of this? Like, do you think that there's like a hopeful thing that could come out of all of this?
I think so. You know, hopefully one of the things that I think, you know, I've been using telemedicine for years, but there's so many restrictions on it from a regulatory standpoint. We haven't had wide adoption of telemedicine, but hopefully, you know, just telemedicine services can expand. When you're in a state like Tennessee, where we have a large rural population that frequently travels long distances to come see us for subspecialty care, especially, you know, I'm a subspecialist, a cardiologist. There tends to be primary care doctors in most communities, but there's not always cardiology. And I'll have patients that'll come an hour or two to see me for a checkup. Hopefully we can expand and do more of that over the phone. And then even providing services to rural hospitals, you know, that's one of the challenges with a lot of these small hospitals or critical access hospitals. They don't have subspecialists because it's not very large and you don't have enough patients to see. But hopefully we can expand into that. And then, you know, hopefully we also understand the importance of being prepared and having a nationwide disaster system. You know, I think this has shown that we really do not have a great way to handle a national emergency in a unified way from our medical systems.
That's true. And then all of this, you know, running around to try to find the right equipment and so on and so forth to equally share where it's needed or equitably share where it's needed, so that you don't have stockpiles sitting in New York if you need it in Memphis or Louisiana or whatever, and people don't know where everything is. If there was some sort of national data bank or something like that where you had all of that information keyed in, then that would be an opportunity, I would think, to improve on our entire healthcare system.
No, I agree. You know, while if you look at the numbers that are expected, we probably have a shortage of all of these things just overall, but there's huge, huge gaps. You know, like right now, we don't need any ventilators, and New York has a huge shortage of ventilators. So if we had a very well coordinated system, we would ship all of our ventilators to New York. And then as we got more ventilators, we would replace them in other places. But we don't have anything like that. And, you know, and with the technology we have today, it would require setting up a system, but it's a possibility, I think.
Okay. Well, thank you so much for talking with me today. Is there anything at all that you want to share in addition to what we already talked about that we could share with our viewers and our listeners?
Yeah, you know, I think while it's hard to be socially distant, it's the right thing. You know, hopefully we'll all realize that we don't need all the things that we thought we did, and get, you know, and hopefully we'll all get to enjoy some time with our family and, you know, be outside and do some of the other things that we kind of forget about. The other thing I would say is, you know, I've been still overwhelmed by the kindness and support of other people. It's still really nice, you know, being in the hospital, even when people are really afraid and scared, you still see lots of tiny, tiny acts of kindness all day long. And I think it's important to remember that, you know, especially in these times when we're all fearful and we don't know what the future looks like, to remember we're all people and let's try to treat each other with kindness.
I agree. Thank you so much. Thank you so much. I really enjoyed talking with you today.
Yes, me too. Thank you. And I hope this turns out well.
All right. Thank you. Thank you for listening today. Subscribe to this podcast to hear all our episodes. Go to shoutyourcause.com to our podcast page for information on our guests and notes from this show.